Thank you all for being here again. It's Tuesday, so it's time for our weekly press update. As we've said before, just to reiterate what the goal of these things, the idea is that we come out every Tuesday morning or thereabouts and do a quick update for all the local media outlets to kind of put some things on your radar that we want to make sure people are aware of and to take any questions that you might have. So I'll start off with a few quick updates on the Hard Rock. The key news there is that we are on track. We do believe they're going to be working this week to take down that tower crane, and we're on track to begin the process of recovery of the remains starting next week, the week of the 13th. The earliest day that we would expect to see the beginning of recovery probably would be the 18th. Chief McConnell has informed me it takes about 4 to 5 days usually. That will be the anticipation. This all is assuming that everything continues to go smoothly, that we don't run into delays with the weather or anything like that. But the timeline remains on track. We do hope to begin recovery of our people's remains next week on the 13th. COVID. So as of yesterday, New Orleans had 8,143 cases and 534 deaths. There were no new deaths over the weekend. We are very encouraged by the compliance that we saw this weekend. Winston Reed, particularly with code enforcement, he and his team were out there in force, and he was very gratified to see so many, not just residents, but businesses working to be in compliance with the guidelines that are out there. That is what is going to make the difference. The compliance that we see within the community, within our businesses, within retail and hospitality across the board, that compliance is what's going to help us get through this. And we are very, very grateful for everyone being responsible and for the business community continuing to be good actors in this. There were 91 large gathering calls over the weekend. As Dr. Avegno mentioned yesterday, there is now a shortage in some of the supplies that we need for testing. It's my understanding that that's not the actual tests themselves, it's some of the material that's needed to process them further up the chain. It's a supply chain issue that people are seeing all over the country. Regardless of where you are, where you're going to get tested, you are likely going to see a delay, and you're going to see, unfortunately, a delay in getting those results back. We are pushing as hard as we can on every level to get that resolved, particularly on the federal level. Our federal delegation, Representative Scalise, Senator Cassidy, have been working very hard, and all of our federal delegation to push for a resolution of this on the federal level. At Dillard University today, they completed 150 tests. I believe that completed shortly after opening, but not as quickly as yesterday. The Pythian Market today will be testing from 3 to 5 p.m. And yesterday, CORE tested 209 people at Cochon. Two other things to be aware of this week. There will be an evacuation exercise. This Friday, NOSEP is working with public safety agencies and partners locally and regionally to conduct an exercise that'll be held at the Smoothie King Center. That's an assisted evacuation plan exercise. That'll be for Friday. The idea is it's a functional exercise, so it's going to be walked through in real time. There will be volunteers on site, role-playing essentially as evacuees, and volunteers and city staff that participate in the exercise, moving from registration at the Armstrong Park evacu spot to the Smoothie King Center for processing and onto a bus in a mock evacuation exercise. This exercise will allow the NOSEP staff and partners to train on new pandemic protocols, including the issuance of masks and the implementation of social distancing measures to prevent the spread. All participants will be given masks and required to socially distance. The exercise should begin around 8 o'clock on Friday at Armstrong Park. There will be a press conference later that day with the mayor and with our public safety and public health leaders, probably around 2:30. There'll be additional updates from our office out this week on the details of that. One other thing I wanted to talk about was the meal program. As I think hopefully some of you should know by now, the city of New Orleans is offering a 30-day meal assistance program that will engage local restaurants, providing much needed food to eligible New Orleanians experiencing food insecurity due to the COVID pandemic. Eligible residents include seniors aged 95 and above, adults with high-risk health conditions and special medical needs, individuals who test positive for COVID-19 or have been exposed and require isolation or quarantine, homeless residents, and children under 18. Right now we have 1,600 people signed up. I think that was the number yesterday. But if you need to apply, you can call 311. And with that, we'll take questions.
Number 4, WWF.
Oh yeah, any comments on the yesterday and this weekend on the increase in violence on the streets?
Right. Let me see one sec. I had some stats in front of me that will be helpful with this one. I can tell you broadly that, this is from having worked with the NOPD for a time before I came on with the city. We know that a surge or a spike over a weekend like that is not a trend to make. Although that said, as you've heard the mayor say, you've heard the chief say, one is too many. So certainly the incidents we saw over the weekend were concerning and something that the NOPD is looking at closely. Over the weekend we had 9 shootings, 4 resulted in fatalities and are now being investigated as homicides. 3 of them involved multiple victims, and there were a total of 14 individuals killed or wounded by gunfire. That's frankly too many. And Chief Ferguson and Mayor Cantrell obviously are very focused on making sure that we devote every resource necessary to resolving these issues. I know NOPD is hard at work. They do not discuss tactics publicly, so I can't tell you about any tactical shift that they're going to be making in terms of those investigations. But I will tell you it's a priority and it's a focus for the mayor and for the chief as well.
Rowland. Fox 8.
Sure. They sent me a few questions.
Sure.
One is about with testing running out. What are you telling people who have symptoms? Are there other places that you're trying to send them?
Not additional places. However, we do want to make sure that we're prioritizing individuals who are symptomatic. As Dr. Begno has said, unfortunately due to the testing limitations, we do have a certain governor for how much we can do on any given day. But we want to make sure that we are reaching out to people who are symptomatic. Whatever resources that you can tap, and we want to make sure that we're making all those available in the city end, and also through clinics, hospitals, your doctor, what have you. The issue is less getting the actual test than it is getting the results, and that's where we're seeing the problem. That's further up the supply chain than on the local level.
Another question is, does the city have enough manpower to handle the complaints over non-compliance? And with those non-compliance calls, are most of those calls for businesses or are they for parties and
Sure,
gatherings?
yeah. I will say on the manpower issue, so far we've seen really great success with the task force that the mayor's mentioned, and that brings in staff from multiple different agencies on the city and the state level. So far there, we're not having a manpower issue. As I said, Winston Reed himself was out last weekend and was very gratified by the results that he was seeing. The complaints tend to range pretty far. I know that we did have, I don't have the number right from me, but we can get up with you on that later in terms of, I think there were 40 that were bars last weekend. But by and large, when Winston and his team arrived, they were able to see people that were in compliance, that were acting in accordance with the guidelines, and were being responsible. And that's what we'd like to continue to see.
Anything else, Fox 8? WDSU.
Yeah, what's the latest on the percentage of COVID tests coming back positive? And has the city set a threshold that if it crosses, will there be new restrictions?
Yeah. So through yesterday, through July the 6th, we had a 4.2% positive on the tests. That's with 20.5% of the population tested. And new cases were down to 89.9% from their peak several months ago. In terms of a specific threshold for when we would look at additional guidelines or a snapback, we have not yet established a public metric for that. That's something that the mayor and the public health team are looking at very closely. I will say, having spoken to Dr. Rebecca and to the mayor, it's the last thing anybody wants to do, is to put us back into lockdown. But that is going to be driven entirely by individual responsibility, by our residents, by our businesses, by the hospitality community, by the retail community, and everyone individually acting responsibly and adhering to the guidelines.
Fox 8, did you want to have?
Yeah, sure. The 311 center, being asked, are there volunteers being asked to answer 311 calls? And are there more 311 calls than 911 calls?
I would have to defer you to Tyrell and Marcus on that over at OPCD. I don't have those numbers in front of me.
And the last question they have for me is just where is the city in the process of renaming streets?
Of renaming streets. My understanding is that process is working its way through the city council right now, and I refer you to their deliberations on that.
Thank you so much.
WTNO.
How will the workforce development team's short-term job training help unemployed residents throughout the city?
I'm sorry, how will the
How will the workforce development team's short-term job training help unemployed residents throughout the city?
Well, I think there's a broad answer to that, which is that the workforce development team and all of our partners with various agencies are working to find opportunities at every level, wherever they can. In the instances that you're talking about with the short-term job training, what they're working to do is just to make sure that people who, for whatever reason, largely due to the pandemic, are unable to find work right now, are able to access resources that will give them either additional training or connecting with additional opportunities. There's a whole range of those, and I would encourage you to explore the site. Sune and Ellen and her team have it all listed very well on NOLA.gov. I don't have the stats in front of me right now, but I will say that I know their overall goal is making sure, and the mayor's goal clearly is making sure that all of our residents are connected with opportunities wherever possible.
And I have two more questions concerning this. I'll just throw them out
Sure.
at you if you can't answer them. That's
Yeah.
okay. Many residents are saying that short-term job training isn't enough assistance. What is the city's response to that? And also, what day does short-term job training begin, and what are the hours, if you know?
I can tell you on the second part, I don't know those off the top of my head, but we can certainly get them to you afterwards in terms of the date when they begin, what the hours are all the time. I can follow up with you on that. In terms of, is it enough, is it not enough? As I said, we want to make sure that we're doing everything possible. Any one piece is not going to be the whole solution, but every piece can be part of the solution.
Thank you. Appreciate it.
Any other questions?
All right.
Thank you.
Short and sweet. Thank you very much, gentlemen. I appreciate you. See you back next week.